So good evening, friends. Meeting again on the concluding part of the first aphorism. Yesterday we have finished the doctrine of chronic diseases, and in detail we have learned regarding the all the laws of the homeopathy, and that's why, as it is termed, all the cardinal principles of homeopathy we have discussed in length. Now only one part, that is Herring's law of direction of cure, which we have little bit discussed in yesterday's lecture. I want to share a few more things regarding this law, and then we'll conclude the first aphorism. Generally, this law is very useful for the finding it out the prognosis of our case. Whenever we deal with the patients, the prognosis is always dependent upon this law, and that's why this is a parameter with which you can apply, or with which you can think whether you are on right path or wrong path. And for that purpose, Herring's law of direction of cure one should understand in clear. We have discussed the Herring's law of direction of cure as it is nothing but the cure should take place from above downwards, within outwards, from center to periphery, from the organs of greater importance to the organs of lesser importance, and in the reverse order of appearance of the symptoms. Every point is very important. The symptoms should disappear from above downwards. It is very important. Word is very specifically mentioned. The symptoms should disappear from above downwards. So if there are symptoms which are related with the brain, they should go first. If there are symptoms related with the respiratory tract, they should go later on. Then if there are any symptoms related to the extremities, they should go on at the end. So this should be related with the symptoms in relation with the importance of the systems. For example, if you take that, if there is a nervous system which is affected, and at the same time few features of the GI tract they get affected, at the same time some skin manifestations are there. So if the disease has to disappear, it should disappear right from the first most important, that is the nervous system, then the GI tract, then the skin. It should follow the typical way. And if it is so, then you are on the right path. If you are treating certain patients, and if your patient is having skin manifestations, and all of a sudden after treating skin manifestation, patient started getting asthma, it means that you are on the wrong track. Or if patient started getting some brain irritation, it shows that you are on wrong path, and the case should be revised at that time. So every follow-up is very important, and that's why you must go through the follow-ups in detail with the application of this specific law. So from center to periphery, it is the same. That is, the from center is nothing but the vital force, center is nothing but the mind, center is nothing but the psyche of the human being, and from there then to the periphery. So first, if you will consider the human mind, the consent should get stimulated, the consent should develop. If it is stimulated and if it settles, then automatically everything gets reflected and everything gets settled. And that's why the cure should take place from center to periphery. Organs of greater importance to lesser importance already we have discussed. And last point which we have discussed over there in the reverse order of appearance of the symptoms, and this is in some cases this chronological order is very much necessary when you write down the case, so that you can find it out how the disease is disappearing. Then you can track that, and with the help of that you can understand whether you are on right path or not. Two things are very much necessary to understand. There are two ways of applying this Herring's law of direction of cure. If you practice with a constitutional treatment, finding it out a miasmatic remedy on the basis of whole history, at that time the cure should take place from center to periphery. But if you are considering the states of the human being, and you are considering the present state of the human being, then your line of treatment or then the order of cure is always should be in the reverse order of appearance of symptom. So in general, when you think about the Mumbai homeopathy and the Calcutta homeopathy, two different aspects of looking toward the patient in a different manner. Mumbai homeopathy is nothing but related with the considering the whole human being, finding it out each and every layer at the same time, the human psyche, at the same time, the constitution, at the same time, the miasm, at the same time, mm, the all the past and family history, everything when they take into consideration, then the medicine which is found it out on the basis of that should act from center to periphery. But if you are doing a practice according to the Calcutta mode of homeopathy, where they give maximum importance to the presenting state, at that time it should disappear by layer. If the presenting layer disappears, then the earlier layer should come. Then again, if you are treated the earlier layer, again it should it goes in reverse order, and again another layer comes, and then you reach to the first layer, and then you treat that patient in the similar manner. So it doesn't mean that the one method is right and one method is wrong. Both methods at their level, they are both right. Only thing is that you have to understand them properly. And this is what I want to explain to you regarding all this. So we have started with the first aphorism in the one last month, nearly about 1.5 months back. And today we have finished the first aphorism. And that's why I have told you that if you want to learn the organ of medicine, you must learn the first aphorism, where you can revolve around the whole homeopathy while discussing the first aphorism. And if you understand it by heart, then it becomes too easy to enter into the second and third aphorism and further aphorism. Then it never requires too much time. The second thing, you must read the footnotes. Footnotes are very essential. For this first aphorism, there is one footnote, and where he has compared what is homeopathy and what is allopathy. The differentiation is always there between two pathies, generally at the level of footnotes, while whenever Hahnemann have explained the homeopathy. And this comparison gives you a comparative understanding and comprehension about the two different pathies. So as it is termed, and word is having one specific footnote. As it is termed means according to the cardinal principles of homeopathy, as compared in allopathy, there are no principles. Everything is based upon everyone's theory. And that's why we'll read that footnote and we'll find what he wants to explain over there. So we'll start with the footnote. Again, open your books. Footnote number 1. His mission is not, however, to construct so-called systems by interweaving empty speculations and hypotheses concerning the internal essential nature of the vital processes and the mode in which diseases originate in their invisible interior of the organism, whereon so many physicians have hitherto ambitiously wasted their talents and their time. What he is explaining? Exactly opposite is there with the allopathy. There is no principle, there is no system, there is nothing which is experimented. Whatever is there is speculative. What is speculation? Speculation manje tark. It is based upon the thoughts. It is based upon just a reason. And everything is based upon empty speculation. He is explaining that empty speculation, it doesn't have meaning. It doesn't have experimental proof. Someone wants, someone thinks as this should be done in this manner, and they explains it to the. We have taken this experience just last 2 years. When COVID has started, someone explained that this is the protocol for the COVID. After 2 months, the protocol was changed. Then again, after 2 months, it was changed. They have started with one medicine, again explained that it is not at all useful. After 2-3 months, 4 months, every time protocol was changed, because there was everyone coming out with their own speculations, and nothing was experimented. No one was knowing whether that remdesivir is useful or not useful, steroid is useful or not useful, All those things, all those are trials and errors, which are based upon only on their theoretical knowledge. And this is what happens with the allopathy. And he explains many physicians have hitherto ambitiously wasted their talents and their time. They have wasted their time to find it out the cause of the disease. Hahnemann says how it can be possible for you to find it out the cause. Because cause is dynamic. You cannot find it out by any instrumentation, not with your naked eyes or not with the even any specific instruments. So you are wasting your time, precious time, to find it out the cause of the disease. And because of which Hahnemann labels the allopathy, it is nothing but the only a theoretical science. What he further says over there, whereon so many physicians have hitherto ambitiously wasted their talents and their time, nor is it to attempt to give countless explanations regarding the phenomena of diseases and their proximate cause, which must ever remain concealed, wrapped in unintelligible words and in an inflated abstract mode of expression, which sound very learned in order to astonish the ignorant. What is it? This is the method of allopathy. Whenever you go to an allopath, they goes on finding it out the cause. If you have fever, when you go to the allopath, what do? They ask you to go for certain investigation in order to find it out the cause. Many a times, if you do a 10 times investigations, 9 times you never get a cause. Everything points it out normal. Because it is not possible to visualize each and everything, and whatever you visualize is nothing but only the prima causa morbi. It is only the superficial cause of the disease. Prima causa morbi is nothing but the virus. Prima causa morbi is nothing but the bacteria. Prima causa morbi is nothing but the parasite. So this is only a superficial cause. The cause never lies over there. The basic causes are always the dynamic and which are invisible. So Hahnemann says, why do you waste your talent? Then second thing which he criticized over there, that they gives or labels the big names to diseases. This is very interesting. This is what happens when you go to allopathy. I have very good example. My father, who was suffering in 1990 when I was doing the internship, or I was in fourth year most probably, he suffered from very severe cramps in the lower extremity, specifically in the calf muscles, and he used to cries during the sleep because of cramp, and he wakes up and he got very severe cramps. Uh, he has shown it to the physician over here, the surgeons over here in Sangamner, and they have done the serum calcium, they have done the potassium, and everything found to be normal. And nearly about 1.5 months, he was suffering from the same thing every day at night, and he was not getting recovered. So ultimately, the physician over here asked him to meet the neurologist in Pune. So he came to Pune. So went to the neurophysician, who asked that you do one thing, EMG nerve conduction study. His EMG nerve conduction study was done. And after doing EMG nerve conduction study, which was found to be a normal again, then every report was normal, and he is already on the, he was taking the potassium and calcium, everything. Then he asked eagerly to the neurophysician, so what do you feel? What is my problem? And he calmly answered, these are called as nocturnal cramps. So what he is having the cramps at night. He has given italic name nocturnal cramps. That's all. So these are the words which they used to use. And he asked what to do. He said, nothing. Already you are taking everything. Nothing I can prescribe. Ultimately, I was a student at that time of the homeopathy, but still I have tried my level best and I have prescribed him cuprum metallicum. And from cuprum metallicum in 1990, when I prescribed him, till today, he never suffered from those cramps. So see, this is what Hahnemann says, that instead of wasting your talent on finding it out the cause of the disease, you match the totality. You just find it out what is the totality of the patient and find it out a right remedy and prescribe that. And that's why he says over there, which should sound very learned. You feel very learned when you give name to the disease. Astonish the ignorant. The people who are ignorant, they feel, oh, I have this disease. Have you seen the Anand movie? Anand by Rajesh Khanna and Amitabh Bachchan, where Rajesh Khanna had cancer. So they both of them were very close friends. And when Rajesh Khanna was investigated by Amitabh, and he was in a very sad mood. Amitabh was in a very sad mood, being a doctor, being a cancer doctor. And when Rajesh Khanna asked, what from what I'm suffering from, he says nothing, nothing. In order to tell, doesn't want to tell. But he asked, tell me my disease. And the Amitabh answers, you have lymphosarcoma of the intestine. And then he gets astonished. Yes, I have very good disease, because name was very interesting. This is what happened. This is how they tell the name. And this makes the astonished to the ignorant. What Hahnemann says, while sick humanity sighs in vain for aid, actually they want the aid. You are not giving the aid, you are telling the names of the diseases. This is what he criticizes. Of such learned reveries, reveries manje diva swapna, manorajya, to which the name of theoretic medicine is given, and for which special professorships are instituted. There are many professorships are given. Many professorships. There is first they have developed PG, MD, then thereafter super specialty, DM. Then there are many professorships are given. First there was only MS general surgeon. Then there was a plastic surgeon. Then there was a hand surgeon. Now there is finger surgeon. After some time there will be nail surgeon. So such professorships are given. Hahnemann criticizes what is the use of giving such professorships and just finding it out the theoretic medicines. Ultimately, there is no answer to it. And he was criticizing that. He says, of such learned reveries, we have had quite enough, and now it is high time that all who call themselves physicians should at length cease to deceive suffering mankind with mere talk and begin now, instead for once to act, that is really to help and to cure. And what he says, instead of finding it out cause of the disease, instead of labeling the disease with different names, giving a big names to the diseases, this is just a false talk. It is not of any use. So what is it? Instead of that, you find it out a remedy. You just do one thing, find it out what is the totality of the patient, find it out the right antitype totality, choose the right remedy, give it to the patient, and just see the results, what happens. This is too important. This gives you a right perspective. It helps. This is the need of the patient, that he wants the result. And you are just labeling the diseases with different names. And Hahnemann criticized this allopathy with this theoretic medicine. He has used that this is the theoretic medicine and this is not of having any practical value. So he has compared homeopathy with the allopathy. In the first aphorism, he explained that our pathy is based upon 7 cardinal principles along with the Hering's law of direction of cure, whereas the modern science is not at all based upon any specific scientific principle. It's based upon only on empty speculation. And that's why there are many theories comes. If you think about the treatment of cancer in allopathy, first they used to do a surgery. Then someone comes out, no, instead of doing surgery, better to start with the chemotherapy first and then we'll go for surgery. Then third person says it's not good. Instead of that, we give the radiotherapy first, then you go for surgery. Then someone says, no, you do the surgery and radiotherapy and then think of surgery. Everyone was coming out with their own thoughts, and which is not a scientific method. Scientific method is always a method which is experimented, which comes to a certain general specific principle. And such principles are missing in allopathy. And that's why Hahnemann criticized this allopathy on the basis of that. And that's why he labeled the allopathy with the theoretic medicine. So whenever you read the organ of medicine, never forget to read the footnote and understand the footnote in a proper manner. Once you understand, then you will get the whole perspective about what Hahnemann wants to say. And this is the, in fact, the interest, or this is in fact the theme which is there in the learning the organ of medicine. So we have finished the first aphorism, including the footnote, and now we'll turn towards the second. Already we have discussed this second aphorism while discussing the cardinal principles of homeopathy. So now there is no too much time is required to go for second aphorism. We'll finish that immediately. What he says over there is very important. The words which he has used is very important. The highest ideal of cure is rapid, gentle, and permanent restoration of the health, or removal and annihilation of the disease in its whole extent, in the shortest, most reliable, and most harmless way, on easily comprehensible principles. See, every word whenever Hahnemann have utilized in this organ of medicine, specifically in the 6th edition of organ of medicine, he has judged before writing it down. He never said, he has not defined the ideal cure as the cure should be. He has not used the cure should be, cure must be. What he says, the highest ideal of cure. What is highest ideal? Ideal means it is the thought, the idea, the theme which happens in your mind. And what is it? How it should be in your mind? It should be in your mind in this manner, but it is not always like that. It is ideal. Our thinking should be ideal, but reality is not always like that. And that's why there is a difference between ideal and a reality. But one should go always with the ideal so that he can achieve some goal. And that's why Hahnemann starts this second aphorism. The highest ideal of cure is rapid. The first word which he used to use is rapid. It should be as early as possible. The word rapid means as early as possible. Gentle, the word which he has used very properly. Why he has used the gentle? Because when you find it out, the results in allopathy, the patient suffers from the very severe rheumatism and he takes the painkillers or analgesics or anti-inflammatory, and he feels better at the joint level, but he starts getting burning in stomach. So what happens? At one level he is better, but at the another level something new has started. Some trouble have been already started. So this is not called as a gentle. When you use the word gentle, it means it is not causing any harm to the patient. The disease should disappear in a gentle manner so that he will not find it out when the disease has finished or when the disease has vanished. And that's why the second word which you used is the gentle. And third is very, very, very important, and permanent restoration of the health. Permanent, the word is very important. Why he says permanent? Permanent is important because it should not happen like that you take a puff of the inhaler and patient feels better for another half an hour and again he starts getting breathless and he develops same troubles again and again. It should not be like that. If you are treating the asthma, you give the medicine and it should work, and it should work in such a manner that it should vanish forever. It should not recur again and again. And that's why he explains the highest ideal of cure is rapid, gentle, permanent restoration of the health. The words which you used to use are in earlier aphorism also. Sick to the health. And again he says restoration of the health. Means it is not just symptoms should disappear, but the original state of the human being should come. This is too important. The original state of health means where mind, body, and soul runs in a perfect harmony. Means the person should be again able to apply his mind according to the his own principle, vital principle, and he should achieve what he wants to achieve. There should be a harmony again. And from the disease state, he should come again into the state of harmony. This is what he expects. It is not just disappearing the fever, but patient should be able to work again in the similar manner. And that's why he uses the word the restoration of health, or removal and annihilation of the disease. Removal or annihilation. Annihilation means completely removal, complete removal. समूळ नष्ट करणे. Removal and annihilation of the disease in its whole extent. What do you mean by whole extent? Whole extent means if the patient is suffering from the chronic disease because of chronic miasms, you are able to remove those chronic miasms. The defects which are there, the dynamic defects which are there in the human being, your medicine should able to remove that, so that you can say it is in the whole extent. Just removing the symptom is not a whole extent. And that's why he uses the word removal or annihilation of the disease in its whole extent. Again, he says in the shortest. Shortest is a very important word. Again, as early as possible. So it should not happen. There is always a comment on homeopathy. Homeopathy is very slow in action. There is one joke prepared by someone that when you start treatment to the child, the cure happens when that child becomes an old person. This is criticism, and that's why Hahnemann says it should not be like that. It should be as early as possible in the shortest way. But second word, which is next to it, very important. Most reliable. What do you mean by most reliable? To whom you can rely. This is too important. Why it is called as too reliable? To whom you can rely upon. Yes, trusted, but to whom you trust. Why he is saying the word reliable? Simple question, on whom you can rely. You can rely on the persons who you know properly. So here he wants to explain that your homeopathic medicines are most reliable because you know them, because they are proved on healthy human beings. Already you know what they used to cause. Already you know that what symptomatology they will going to produce in the human being. And because of which you are fearless while using the homeopathic medicine as compared to allopathy. Because when you use allopathic medicines, there is always fear in your mind whether the patient gets some reaction, some untoward reaction, some allergic reaction, because they were not proved on healthy human beings. They were not known. They were used, or they were proved on the animals, and considering human being as an animal, they have used the medicines on human being. And that's why they are not so reliable. But when you use the homeopathic medicine, they are most reliable, because since Hahnemann have proved all those 99 drugs, still today we are getting the same symptoms in the same drugs after proving. It has not changed. It has not changed in any way. And that's why when you use the homeopathic drugs, they are always most reliable. And last point which you used to use over there, they are and most harmless way. So they never cause any harm. Keep it in your mind, they never cause any harm when used in a proper manner, in a proper potency, in a proper repetition. This is too important. One must have knowledge of how to use the medicines in a proper potency as well as in a proper dose. Then they are not harmful. So this thought should be there in your mind, that it should be under certain conditions that they are always harmless. But once I have seen one homeopath, he has prescribed Bacillinum 1M, Bacillinum 1M daily 1 dose for 1 month. So person who was not susceptible to tuberculosis can become susceptible to tuberculosis because of such haphazard use of the nozzle. So then it becomes harmful. Otherwise, it never, it is not at all harmful. And that's why he says, and the most harmless way, again he says, same word, on easily comprehensible principle. So what the end which we have done in first aphorism as it is termed is nothing but again the on easily comprehensible principle. The word comprehensible is very important. Comprehensible means anyone can understand. In Marathi, we can call it as a akalniya. Anyone can understand it very easily. On easily comprehensible principles means on the basis of law of similars, law of simplest, the law of minimum dose, the doctrine of vital force, the doctrine of drug proving, the doctrine of drug dynamization, and the doctrine of chronic diseases. So this is too important. Once you know it in such a manner, then you can go for highest ideal of cure. And this is too important to understand. So we have finished first aphorism and followed by the second aphorism in today's session. It is too simple to go ahead now because your concepts regarding the homeopathy, regarding the organ of medicine, they are quite developed because of learning the first aphorism in detail. So now we'll have a little bit speed to understand the concept. So this is what Hahnemann wants to explain about the highest ideal of cure. And this is just a thought. Every time it never happens, but our aim should be ideal. And that's why he says highest ideal of cure. In tomorrow's session, we'll learn the third aphorism. Third aphorism is nothing but the miniature of organ of medicine. And it is too important to understand the qualities of the homeopathic physician. They are mentioned by Hahnemann over there, and every quality one must understand in depth. So in tomorrow's session, we'll have a big time again. This I don't think we can finish that in tomorrow's session because we have to understand everything from that aphorism. So today we have finished this, the highest ideal of cure, as well as the Hering's law of direction of cure.
Sir,
Yes.
good evening, sir.
Good evening.
Sir, I have a doubt.
Yes. What is your doubt?
Sir, it's about a case. Like few days back, I got a patient who used to get मतलब who used to get suppurated. Like उसकी हर injury suppurate हो जा रही थी. Even the minor injuries got suppurated.
Hmm. Hmm.
Hello.
हाँ बोल.
So, sir, he had a history of tuberculosis. So I could not prescribe Silesia to that patient. Sir,
Hmm.
in such cases, what is to be done where Silesia is the only indicated remedy, but that patient has a history of tuberculosis?
Question is that if it is a open tuberculosis, you should not use Silesia. If it is a healed tuberculosis a way back, you can use Silesia, no problem at all. You can use Silesia in biochemics. You can give the Silesia in 6x potency in such types of patients. It
मतलब it is
doesn't.
safe for any time.
Yes, it should not be
6x,
used in
Silesia 6x.
open case of tuberculosis. Means when patient is already
Open
having
in the sense
tuberculosis.
currently.
Yes, patient is
Okay,
having the
okay,
tuberculosis.
okay,
You can use, no problem.
okay.
So
मतलब
one more.
even if he had the history of tuberculosis, and we can use Silesia
Yes,
6x or any potency.
yes. Only thing is that don't go on repeating it too much. If you are
Okay.
giving
Thank
the
you, sir.
antisemal, don't repeat it too much. That is the only thing. Second thing I want to discuss with you that in 2 days, I am the guest invitee in the Divine School of Homeopathy. And it is just because the other two teachers, they were busy and they have invited them, but they were busy and all of a sudden they have said that they will do it next time. So today, I will be there at 9 o'clock with new aspect regarding the understanding. Many practitioners and many homeopathic students doesn't understand the word the state of disposition. And it comes, Hahnemann every time utilize this word. The state of disposition is very important for the prescription. So what is state of disposition and how to understand the state of disposition? That is what we have to discuss in today's session. It will be again a practical session where it will be everything is explained on basis of cases. So you must be there in the today's session. Those who have joined, it is very important for everyone. Those who have not joined, join the Divine School of Homeopathy so that you can learn all those theoretical aspects in a practical manner. This is too important. Whatever is there in the organ of medicine should be practically expressed. Then it becomes simple to apply. So in today's sessions, I will going to conduct regarding the understanding of state of dispersion. Yes, I will be there sharp at 9 o'clock. So do join over there and have a feast for the state of disposition. Those who don't have, they can contact just a number. I will give number 7249 042 978. Dr. Prerna, you can contact Dr. Prerna. She will ask you how to join the Divine School of Homeopathy. Okay. So this is the number which I have given over there. Those who have not yet joined our school, they can join, and every day they have session. Only one thing, from tomorrow there will be no session of Divine School of Homeopathy. From tomorrow, Dr. Gaurang's session will going to start, and that pediatric aspect about the homeopathy. So from tomorrow onwards, every Friday, we don't have a Divine School of Homeopathy session. It will be only conducted on Monday, Tuesday, Wednesday, Thursday, and directly Saturday, 5 days in a week. So that's all for today. Thank you being there, sir. Dr. Vasudev, Dr. Manisha, then Dr. Napendra, Chaitrali, Ali. Yes, Ali, good evening. Dr. Ifat, Dr. Prasanna, Preeti, Maithili, Rutuja, Karuna. Yes, thank you being there, and good evening, good night also to you, and we'll meet at 9 o'clock. Thank you.